Preventing and caring for pressure ulcers for the paraprofessional. Anatomy of the skin. What makes up your skin? Two layers of the skin are called the epidermis and the dermis. The top layer is the epidermis, below is the dermis. Underneath these layers of skin is a layer of fatty tissue that protects your muscles and bones from injury. This layer also is your insulation and keeps your body heat in. Functions of the skin. Your skin protects you from infection. It produces vitamin D. It regulates your body temperature. It excretes oily fluid to lubricate the skin. It senses potential danger through the nerve endings. Aging changes your skin. The oil glands produce less oil. Your skin thins. The circulation decreases, therefore decreasing the skin nutrition. The walls of blood vessels become thinner. The result is that your skin becomes drier, more prone to breakdown and trauma like skin tears, and it's slower to heal. Prevention is the key to skin management. The plan of care should include pressure ulcer prevention measures. Make sure you are comfortable with the plan of care for your client. Ask for help when you are unsure or have a question. If you notice a change in the client's status, report this immediately to your supervisor. Reporting issues, a review. Report the new observation by calling your scheduling supervisor. That supervisor will notify the clinician or case manager involved in that client's care. Report the observation or incident in writing on the back of your work ticket. Date, time, to whom it was reported, and the details of your observation. For example, you notice a new open wound on your patient. You call and report it immediately. Another example is if your patient is only seen every 2 weeks by the nurse, but 2 times a week by you, when you notice a reddened tailbone area, you report it. The scheduling supervisor will notify the primary nurse, who will see the patient sooner to observe her skin. What is a pressure ulcer? It is a localized area of tissue death that tends to develop when soft tissue is compressed between a bony prominence and an external surface for a prolonged period of time, like a bed or a chair. A pressure ulcer is any lesion caused by unrelieved pressure resulting in damage to that underlying tissue. Major causative factors in pressure ulcer development include the intensity of the pressure, the duration, or how long that pressure is applied, and the tissue tolerance, the tissue health of that patient. External factors affecting your skin tolerance include shear, the interplay of gravity and friction, the parallel forces to the skin, for example, the patient sliding toward the foot of the bed when the head of the bed is elevated, and friction, causing skin damage to the outer layer and upper dermal layers, i.e. like sheep burn. Does your patient have these risk factors? Advanced age, immobility, requiring assistance to change position, incontinence, poor nutritional status, and poor sensory perception, maybe being confused or unable to feel their sense of pressure. Locations of skin breakdown. Pressure ulcers typically occur over bony prominences. Think now, if your patient is lying on his or her back, where are pressure ulcerations likely to occur? Think back of their tailbone area, heels, most common areas. What if your patient is lying on his or her side? I think hip most likely, knees, your outside ankle area. When your patient is seated in a wheelchair, new pressure ulcers coming on both buttocks, maybe the tailbone. Pressure ulcer staging, the signs and symptoms of the damage to the skin. A stage 1 is redness of the skin that does not return to normal color within 20 minutes. Might have swelling or heat in the area, but there is no open skin. Here is an example of a stage 1 pressure ulcer. on this patient's right hip. Note the redness. After this patient was turned off of the hip to relieve the pressure, the redness remained for longer than 20 minutes, but there is no open wound yet. A stage 2 pressure ulcer is an opening in the skin that looks like an abrasion, a blister with fluid in it, clear fluid, or a very shallow crater. This is an example of stage 2 pressure ulcers. Note the lower back. This patient has shallow, superficial, open areas. A stage 3 pressure ulcer is a deep crater into the layer of fatty tissue. This is a stage 3 pressure ulcer on the patient's tailbone, the end of the spine, a deep crater, but we cannot see any bone or underlying tissue. A stage 4 pressure ulcer is a serious wound that extends down to muscles or bones or tendons underneath. This is a picture of a large stage 4 pressure ulcer on this patient's lower back. When a client has a pressure ulcer, the dressing should be in place over the ulcer site. If the dressing falls off, is leaking, call your supervisor so that a skilled nurse clinician can assess and treat the patient or instruct the family on the dressing change. Clients with pressure ulcers should be on pressure-reducing support surfaces. You should know what equipment your client has and how it functions to assure that the device is being used properly. This includes specialty air mattresses, air pads that overlay a mattress, and wheelchair cushions. When a client has a pressure ulcer, the plan of care should address specific nutritional needs of that client. Make sure you encourage the client to follow the plan for proper dietary intake. The plan of care should address the positioning and repositioning needs of the client. Make sure you follow the plan closely to provide adequate pressure reduction. Any new reports of pain, fever, new areas of skin breakdown, or lack of appetite should be reported immediately. Techniques for working with a client with a pressure ulcer. Minimize risk of injury by assisting the client with mobility and positioning according to the plan of care. Encourage activity for those who can be active. Assist the client with exercises if these are part of your plan of care. Encourage and assist with proper nutrition according to the plan of care. Minimize the risk of skin integrity loss due to incontinence. Provide proper cleansing and moisturizing to intact skin according to the plan of care, and observe the skin of your client at each visit. In summary, you are an important part of the healthcare team. You may be the only staff seeing that patient for the day. You are the keen observer of your clients. Any change in status should be reported immediately. You need to follow the plan of care for that client specifically. Ask questions and report when the plan of care is not clear to you or you are unable to complete it. Though you may not be providing direct wound care for the client, you should be aware of the type of wound care the client has, who is providing it, and what to do if there are any problems or issues with the wound care. Your input and information is essential to your client's health and well-being.